On this episode, we'll talk about resleeving, mini gastric bypass versus sleeve, how much protein you should eat after weight loss surgery, and plastic surgery after your gastric sleeve.
Jump!
How I know that am I a candidate for a Resleeve?
So when to know when you're a candidate for resleeving. Now, resleeving, it seems very simple to think, okay, I didn't lose enough weight, I want to resleeve myself and get to goal, all right? But first you need to think about what's wrong. Why didn't you get to goal? Are you eating too many carbs? What are you eating? What was your original bougie size? What was the technique used in your surgery? Who did your surgery? What's the outcomes your surgeon is having? And what's going on behind all this scenario? So don't just think that because you didn't get to goal or your goal. What's your doctor's goal? What's the correct goal? All right, what's your starting BMI? What's your goal BMI? So before you think all that, maybe think something, how your surgery was, how it was planned out, what technique was used for your surgery, what are you eating. Take a look at all of that before thinking, all right, I didn't get to goal, I'm going to look into resleeving. Now what? What's the next step? So rethink about resleeving is not that simple. In our case, we suggest patients get a barium swallow, send it over in a disc. I review it personally. I would like to have an endoscopy, how wide that sleeve is, and think about then doing a resleeve if there's something wrong with the sleeve. I've turned out so many patients down because the sleeve, nothing was wrong with the sleeve. It was the way they were eating. They were eating too many carbs because they're binging, because they're trying to push something into that sleeve that's not healthy. So if that's a problem, nothing is wrong with the sleeve or restrictions there. It's what you're deciding to put into the sleeve. So I hope that helps with your question.
What is your opinion of the mini gastric bypass versus sleeve for long-term results for weight maintenance?
So thinking about mini gastric bypass versus sleeve long-term, sustained weight loss. Well, we have really good studies with the mini gastric bypass. We have really good studies with the gastric sleeve. I prefer the sleeve because it's not that invasive. It doesn't reroute intestines. It doesn't have the malabsorption, malnutrition, malnourishment, vitamin deficiencies that the bypass has or the mini gastric bypass has. But the sleeve has many other advantages anatomically speaking. The same entrance of the stomach that you were born with stays there. The same exit of the stomach stays there. There's no rerouting intestines. There's no malabsorption, the osteoporosis down the road. So there's really good data that supports the sleeve, really good data that supports the mini gastric bypass. It depends on you, what you'd like to have done, depending on your BMI, the way you're planning to work with your procedure. If you think you're decided, you're committed, take the step. Whatever you decide you're going to do really good. The sleeve has amazing results with high BMI patients, low BMI patients. It has a lot to do with the patient. So be committed and take the step.
What is your opinion on the single incision?
Single incision sleeve. Well, I don't like it. I've tried it. I've done it. I've done a few surgeries, but I don't think it's done correctly. So that's why we abandoned the procedure right away. You don't expand or dissect correctly. You don't get to traction the stomach completely. Patients with that are non-single incision sleeves get more restriction than the patients with a single incision sleeve because of the traction you get with the 5 ports or 4 ports instead of with just 1 port and struggling with that tiny incision. So I think it's way better safety, better outcome for the patient that has a non-single incision sleeve versus a single incision sleeve.
Is it true it takes 2 years for your skin to shrink?
All right, it's a myth to think about that your skin will come back after 2 years, all right? So if you have some loose skin, you've got some loose skin. You need to prevent it down the road. You need to avoid it if you start to exercise after your sleeve, focus on what you're eating, getting your skin well hydrated, that helps. But if you're down 2 years down the road and thinking that's gonna actually come back, it's not. It's gonna be loose. So you might as well do something or just accept it the way it is. But it's a myth that actually after 2 years, your skin will actually come back.
I am 3 weeks post-operation and only supposed to lift 15 pounds. It's a daycare job with 1-year-olds. If I am careful, should I be fine lifting the kids?
It's a good question, Franny. All right, so for legal purposes and on the paperwork that we send out the patients with, it says the heavy lifting or the lifting, it's limited to 5 pounds the first week and a 5-pound increment every week after. But for practical purposes, it's easy. Remember, don't lift more than 30 pounds the first 30 days. So no more than 30 the first 30, all right? So if you need to get paperwork from your surgical office, we do it often for our patients. So you might want to get in contact with them and they can type in something that you can readjust it in your work until you're completed your 30 days.
What is the maximum amount of protein we should consume in a day?
All right, so to talk about protein intake, your maximum amount is actually 2 grams per each kilogram of your ideal weight, all right, not or 2.2 pounds. 2.2 pounds equals 1 kilogram. So it can go from 1 to maximum 2 grams per kilogram of your ideal weight, all right? So that's the where it tops off, all right? More than that, it's not recommended. It won't do extra. And less than 1 gram, you're not getting enough protein to regenerate tissues. So don't forget to use the hashtag AskDrA for any future questions that you may have. We'll look for the hashtag Twitter, Facebook, Instagram, YouTube. So any questions, type them in, use the hashtag, and we'll pick them up. Don't forget to subscribe to our channel. That way you don't miss any future shows. And I'm Dr. Alvarez with Endobariatric, and we'll see you next week. So question of the day, I want you to type in your comments down below if you actually focus on protein or you just go as it goes. So do you actually count the amount of grams you intake or you don't?